LL is a 7-year-old male that came into the pediatric clinic for a left foot wart. He has Medicaid insurance and he presented to the clinic with his mother. He lives with his parents, mom and dad, and he is the only child. History of present illness. Mom reports a flesh-colored, lightly crusted, circular wart to the ball of his left foot. It began Sunday and it started gradually. He has mild tenderness to his left ball of foot when he is weight bearing. It does not radiate and he has not gotten worse over the last 2 days. He has tenderness to the left foot when walking without shoes, and he reports the pain at 1 on a scale of 1 to 10. He has never had any warts before. No one else in the home has warts or similar problems. And because of the warts to his left foot, he doesn't want to wear shoes. The past medical history, the pregnancy was planned. The mother only had this one child. She did not have any drugs, tobacco, or alcohol use. The baby was born vaginally and delivered by OBGYN. He was termed and weighing 7 pounds and 6 ounces. He has never been ill. He has no other health histories or concerns. He's never been hospitalized. All his vaccinations are up to date. And he has no known allergies. He doesn't take any medication. The family lives in a local town. They live together, mom, dad, and child. They participate in preventative care. The last dental visit was 6 months ago. The last primary care visit was the day of this clinic. They use safety using seat belts. They don't smoke in the home. The mom prepares the food and they eat together as a family. The child is in the second grade. He participates in organized school activities and physical education classes. The mother doesn't let him use television or video games more than 2 hours a day. The child is developmental stable for his BMI and height and weight. He's within his normal limits for his age, and the mother has no concerns about his growth or development. For the review of systems, they deny any fevers, chills, nausea, vomiting, fatigue. The skin denies any itching or rashes, changes in nails, but there is a pertinent positive for a circular flesh-colored wart to the left foot with tenderness. The head, they deny any headaches or head injuries. The eyes, they deny any glasses or contacts. The last vision screening was 6 months ago. They deny any pain, itching, double vision. Ears, deny any hearing or hearing loss or ringing or dizziness. Nose, they deny any nasal bleeding, loss of smell, no allergies, no signs and symptoms of swelling of lips or anything. The mouth, no bleeding gums, sore tongue, denies any sore throat or anything. Denies any lumps or swollen glands in the neck. Respiratory, denies any shortness of breath, denies any cough, production of any sputum, wheezing, coughing. Gastrointestinal, they deny any changes of appetite or weight changes, denies any swallowing problems, denies any constipation or diarrhea or change in bowel habits. Urinary, they deny any types of difficulty in urine or burning, frequency, or any enuresis or encopresis. Musculoskeletal, they deny any stiffness, deny any joint pain. The only positive was some tenderness to the left foot when walking or ambulating. Endocrine, they deny any type of abnormal growth, increased appetite, or sweating or urine production. And psychiatric, they deny any type of anxiety, depression, suicidal thoughts, memory problems, sleep problems, or anything like that. The child has a BP of 100/60, 80 pulse rate, 18 respirations, 98.6 on temperature. He's 99% on room air. He's 48 inches and he weighs 58 pounds. His BMI is right at 18. He's in the 85% percentile for height and weight, 90% percentile for his age, and his pain was 1 out of 10 on a Warren Baker scale. For the PE physical examinations, he is general appearance. He's awake and alert, no acute distress. He's well developed. He appears to be about 7 to 8 years old, which is a stated weight of 7. His head is symmetrical, round, midline, non-cephalic, and atraumic without tenderness. No palpable masses or anything like that. The hair is of normal texture and evenly distributed. Eyes or visual acuity is intact without corrective lenses. The Snellen chop was done and he's 20/20 on the vision scale. The conjunctiva are clear without exudate or hemorrhage. The sclera is white. The EOM are intact and perla. No signs of nystagmus. The ears are normal in shape and position. There's no tenderness or swelling. The canals are clear without discharge. You can see a scant brown serum inside the ears. Examination with the otoscope shows the tympanic membranes are pale gray and translucent with good cone of light. No perforation of the tympanic membranes are visible. The nose, the mucosa is pink and moist. The nasal septum is midline. There is no sinus tenderness or septum defects or polyps. The mouth, the oral mucosa is pink and moist with good dentition, no foul odor. The tongue is midline. The appearance is good and symmetrical. No buccal nodules or lesions are noted. The neck is subtle. The thyroid gland is normal without masses. Carotid pulses are 2+ without any bruits. It's full range of motion for the neck. The trachea is midline. The chest and lungs are clear. The chest without distortion. The thoracic expansion is symmetrical. It's clear bilateral to auscultations. The rate and rhythm are appropriate for his age. There is no JVD, no murmurs. The abdomen is soft, symmetric, and non-tender without distension. There is no visible lesions or scars. The bowel sounds are present and normal active for all 4 quadrants. Gentle urinary, there's no palpable masses, no discharge. He's in a Tanner stage of 1. And the physical examination for the skin reveals it's warm and dry to touch. The color is appropriate for race and ethnicity. The nail beds are pink. The left foot plantar side of the head of the metatarsal, there is one flesh-colored, slightly yellow, depressed circular wart that's about 1.5 centimeters. It has pinprick black dot visible in the middle. It feels rough and thick to touch and firm. The board is well defined and interrupts the normal skin markings and ridges. The right foot has no abnormalities or skin changes. Neural mental strength, no gross abnormalities present, normal sensation. General impression is appropriate. He's alert and oriented. Development is consistent with age, and cranial nerves 2 through 12 are grossly intact. The differential diagnosis are plantar wart, calluses, lichen planus, and squamous cell carcinoma. The definitive medical diagnosis for this child is going to be the left foot plantar wart. Nursing diagnosis is acute pain, risk for infection, and impaired skin integrity. The plan is to use salicylic acid plasters with the 40% concentration. We're going to cut it to size and tape it in place for 3 to 5 days. Once that's taken off, we soak the foot for 45 minutes and remove the dead epidermis with a pumice stone. The treatment will last for 3 to 6 weeks and is effective up to 75%. The teaching counseling, we instructed the mom on warts. It's common in childhood and it's caused by the HPV virus. Different strands of the virus can cause warts to the foot. The transmission is skin to skin contact, and incubation can be from 1 to 6 months. We will see the child again in 6 weeks for reassessment. Moving on to the theoretical framework, the patient has intrapersonal and physiological stresses of foot tenderness with weight bearing and the wart growth to the left foot. He has been exposed to the HPV virus, which caused the plantar wart. His body has responded in a negative degree by causing acute pain and tenderness when walking. The patient is in the Erickson school age child development stage of industry versus inferiority and has not developed effective coping skills to respond to discomfort or illness. His normal lines of defense are interpersonal from his mother and father as well as his cousin. Spiritual defense against stressors are aligned with his attendance to Sunday school and his exposure to faith and spirituality. The extrapersonal lines of defense are fortified by him spending extracurricular activity with his dad and uncle. And the school-age child sees their caregiver as their provider and person that assists them in times of crisis. The rationale for the definitive medical diagnosis, the warts are proliferation of the HPV. The wart was shown by physical examination diagnosis with the black pinprick dots and the roughness. It distinguished it from the differential diagnosis of calluses, which are just thick hyperkeratonic areas epithelial that doesn't have any thrombose vessels, which are the little black spots. The lichen planus are kind of red or pink, and they're just idiopathic inflammatory diseases. They can show up on like the shins and the back of the neck, but they mostly don't present on like the plantar side of the foot. Squamous cell carcinoma is malignant tumors. They are easily identified, but they also should be diagnosed with a full thickness skin biopsy, but they show more on the lips, the hands, the ears. They grow rapidly over months, and they have a crusty appearance. So, the client goals is to decrease discomfort and pain. That's the nursing diagnosis of acute pain. We're going to use salicylic acid for treatment. That's for impaired skin integrity. We're going to encourage them to wear protective clothing and barriers to decrease skin-to-skin contact. That's nursing diagnosis for risk of infection. And we're going to encourage proper hand hygiene and washing to reduce risk of infection. That's nursing diagnosis risk for infection. The patient will have a reduction in symptomatology when he implements treatment with the salicylic acid. He will reduce or eliminate current infection and reoccurrence of infection by using proper hand hygiene and not walking barefooted. The interventions that are specific to the NP role: primary intervention is assessment of pain and discomfort. That's NP role of direct patient care. Primary intervention is thorough assessment of the integumentary system, which is direct patient care as well. Secondary intervention was treatment with salicylic acid. That's NP role of evidence-based practice. Tertiary intervention was education on the cause and condition. That's expert coaching and guidance. For the evaluation of the patient goals, when they come back for 6 weeks, we're going to evaluate the ability to maintain decreased infection, denial of pain or discomfort, denial of continued symptoms, and identification of at least 3 risk factors and ways to avoid it. Having minimized outbreaks of no warts or other parts of the body. And if they do not have to follow up, the NP will ascertain that the symptoms have been eliminated and the goals have been met.